All right, let me just read through this real quickly, and then we're going to go over your history in more detail.
Okay.
Let's see. Started 8/24/15. It says you mostly always had headaches. How far back did you have headaches?
I started getting headaches about 16. About when.
The back pain, when did that start?
Well, I've had some like lower back pain, probably back to like maybe 2008, but it's gotten like a lot worse ever since the accident. Like the pain is sort of different.
Okay, we'll talk about the accident in a second. So you had the pain in your back to in your 20s, roughly.
Yeah.
Okay. You had a motor vehicle accident on 8/24/15.
Mm-hmm.
And it says your hair was falling out and is falling out again.
Right. After the accident, like half my hair literally fell out. Like it was like my body was in shock.
Tell me about the accident.
Well, I was driving home from work, and I remember I was talking to my friend on the phone, and I was trying to say up in the tree, like a nest up in the tree, and I remember like saying like up in the, 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 and that's the last thing I remember. And that was like.
And you were the driver?
I was driving.
Okay,
by
were you
myself. Yeah.
Okay, and you were on the cell phone, and you started repeating yourself.
Right.
Okay.
And then that was like 6 miles away from where I actually crashed. I ended up passing by the road that should have gone to my house and recrossed the highway going the opposite direction back west.
So it sounds like a seizure. Any history of seizures?
No history of seizures ever.
None before, none since. Okay.
No, I have had some since.
You have had some since.
Mm-hmm. Okay. I don't remember the accident, but the report says like I rear-ended, I think, a state truck or something, and then ran a van off the road, and then on the opposite side of the road, I hit the side of a dozer trailer, and then hit a guardrail, and then hit the trees head-on, going about 50.
Okay.
I was in a Charger, so that was also fortunate that it was a big beast of a car. It totaled it, and then there was no skid marks or anything, so they think my foot was just stuck on the gas. But the first thing I remember is like the paramedics or the people, they had done jaws of life to get it open.
So you lost.
I don't remember any of that, but they were saying like, "What's your name? Who's the president?" And I didn't know who the president was or anything.
Okay. When you hit the tree, what condition was your car in? I presume you don't remember the impact.
No.
Okay. Did the car just stop? Did you hit your head? Glass broken? Any injuries?
The airbags all went off. The whole front windshield was all cracked and busted. I mean, the whole car is totaled. They couldn't open the door, so they had to cut that open.
All right, so that was quite the impact. Now, always feel like ribs are out and hips. What do you mean by that?
It's not like a new problem that my ribs will be out, but I don't think it's like officially in anatomy terms means out, but whatever. They'll hurt.
They do. Okay. On one side or both sides?
Both sides.
Both sides. Okay.
It'll sometimes make it harder to breathe, but it's mostly just like a irritating pain thing in the back, like all under my shoulder blades back in here.
In the back. Can I actually get you to stand up for a second?
Mm-hmm.
Turn around and show me again where it's...
Like a lot of times I'll feel it where they just feel like they're out here,
okay.
here.
Mostly on the left here?
No, both sides.
Both sides.
But I guess I'm pointing to this side because I feel it today. But
I got you. But you said it also makes it difficult to breathe?
Sometimes. I can tell. And then kind of where like your neck and your collarbone and your rib come together right there, always feels like that needs to snap. Like that three-way joint. It comes down here and across here, and there's some connection spot that...
I got you. Okay. Is this only since the accident that your menstruations have changed?
That has just been recently. That's like my son is going through a lot of mental health issues.
How old is your son?
He's 18.
Okay.
But I've been through 5 other mental stays with him.
So I take it you find that stressful?
But yeah, of course it's stressful. I've changed my whole life.
Okay. What do you mean by your core area feels like it's locked up?
So it's like from here to here.
Okay.
And every everything that's
And this is on both sides?
Yeah.
Okay.
But it's even worse on this side. But it's like everything that's connected here to the back muscles are all so tight that I can't stretch it out. It just constantly feels like I need to stretch it out. It started since I withdrew off a whole bunch of medications last summer.
Tell me about that.
Well, I felt convicted to get off meds because I've been addicted to pills for a really long time.
What kind of pills were you on?
Like the max dose of Norco, the max of Lyrica, long-acting Adderall, short-acting Adderall, Xanax, Zoloft, Wellbutrin, Tramadol, as well as my seizure.
You were on these all at one time?
Mm-hmm.
Okay. And you just went cold turkey. You stopped. Yeah. Okay, what happened?
It was the hardest thing I've ever done in my life and like the worst experience ever. So the only thing I did not go off was my seizure medication at the time.
Okay.
I just felt like maybe that would be detrimental.
Right. Stopping all those medications at once is, yeah, that could be detrimental. So you said things started then. What happened when you went off the med?
The first 8 days was uncontrollable movement, like could not stop shaking, and it wasn't a seizure, it was just uncontrollable movement. I was self-rocking. It was this self-soothing thing of...
Okay. So you were using your core and hip muscles down in that area.
Yeah, and this side I actually felt like at one point from days of doing that, I didn't hear a sound or I didn't feel a tear, but it was just this sudden sharp like jab right here.
Right there in the left groin area.
Right, okay. And then that's been screwed ever since. But all that extra movement did something with locking up this whole muscle system.
So when this, whatever, mm-hmm. you felt this whole area back here get tight or stop moving?
Yeah, basically it all just sort of locked up. And then I switched all my self-rocking to this side.
Okay.
Because I couldn't stop the movement. So then that didn't do a snap feeling or anything like that right here. So this side isn't as bad, but I've way overused it.
Okay.
So for 8 days I didn't sleep.
So when you're saying, I want to go back a little bit. When you said low back pain, well, first of all, did that change? You said you had it since you were in your 20s. Did that change after this incident?
Yeah, after the, well, not after the withdrawal, but it changed after the car accident.
Okay, turn around for me. I want you to touch with your hands where you used to get it.
Oh, well, it used to be like, I don't know if these are called flanks, but
okay.
It used to feel more muscle related.
Okay,
and now
show me where now.
Now it's muscle also, but it's like deep in the bones. Okay. Almost like there's arthritis or...
Let me see where
or like the accident crunched things down.
So that feels, you were indicating more down in here?
Mm-hmm. And you keep going.
So we're actually at the lumbosacral junction and sacroiliac joints, that region. Before it was more up here.
Yeah, it was more in the muscles. And
gotcha.
It almost feels like I was compacted or something.
Okay.
Still in the muscles, really bad though.
So now you have both areas.
Yeah.
Okay.
So it's like both things.
Gotcha. And it says worse on the left side. Is that the part that's higher or the part that's lower?
Kind of everything is worse.
Everything's worse on the left. Gotcha. Okay. And you said that you're hyperflexible. Mm-hmm. All over, shoulders dislocate chronically. How long has that been going on?
Ever since I was little. I'd swing a baseball bat and it would fall.
Is it mostly one shoulder or the other?
This one's worse than this one.
But they both
do? For some reason, but they both do.
Okay.
And there's been weird times like when I used to try to play volleyball where you'd do a slide and it would actually feel like it would go out the back where it wouldn't self go back in. With a swinging a bat, like it goes out and it goes back in. But I've had a couple incidents playing volleyball where it doesn't just go back in, and I had to run backwards into the wall, push it back in.
I want to go back to all those meds you were on. Why were you on all those meds? Was that you were on them only after the car accident, or were you on some before?
So I've been on Lyrica for a really long time.
And you were on that for what?
Ever since it came out for IC, interstitial cystitis. cystitis, however you
interstitial cystitis. Okay, so
say
that's an
that.
ongoing problem. You still have those
And
symptoms? Bladder
yeah.
irritation?
Mhm.
Okay. And the other meds?
Norco I was on a long time ago for headaches and some of that lower back pain. Back in 2008, I was on it for a few years and then I was off. But then after the accident, I got back on Norco. After the accident, I really had a hard time concentrating. I was like speaking like a child for a few months. Had no filter, like definitely a TBI. I went to.
Okay, so they showed brain injury. Did they do a CT scan?
Yeah,
or
nothing showed up like any bleeding or anything weird on the brain scan, but like basically a concussion that wasn't healing fast.
Okay.
So like I went to Mary Free Bed and had a full psych concussion eval and all of that.
And what did they find at that point?
Just that I wasn't recovering as fast as I should have been from the concussion.
Okay.
So the psychiatrist put me on Adderall, both the long-acting and short-acting.
Okay. That was to help your concentration?
Yeah, and focus.
Focus? Okay. All right, it says something here about headaches. Can you tell me about that?
Those started when I was 16, about.
Mm-hmm.
And I pretty much all day, I always have like a low-grade headache, but it's changed. So back when I was 16, I would get like a really bad headache every few days or something. It wasn't like I had a low-grade headache all the time.
Okay. Were you light sensitive when you got them?
Yeah, and nauseous.
How long did they last when you got one?
All day.
All day long?
They seemed very hormonal related, but they turned into a low-grade headache. I had a different car accident in 2004, and if I really try to think, I mean, I'm trying to think how long I've had the low-grade headaches, but it could be since then.
Tell me about that accident.
That I was driving an Explorer and I was passing a semi and I got caught in the slush, and so that one I went sideways off the road and hit trees on my side, going about 50 again, and totaled it. It kind of just crunched my car like that and shot my windshield way out in the cornfield.
So you stayed conscious this whole time?
Yeah, I stayed conscious.
Did you have any injuries from this?
My tips of my fingers were all bleeding.
Okay. Any head injuries, neck?
I hit the side, I hit my window this way.
Okay, left side of your head.
Yeah.
Okay. Did you have, or do you remember having any headaches from that or changes?
Yeah, I just kind of feel like that's when my low grade sort of set in. And it's usually always on this side.
Does it start there, where you're showing me, in the forehead?
Yeah.
Okay. Doesn't have no discomfort in the back of the neck or back of the head?
Not the low grade, no.
All right.
I mean, I'll have headaches
here.
once in a while that I can feel back here. But, the doctor said like I had whiplash. And so I was on Relafin for a few months because it was so tight and messed up through here.
And was that going out the shoulder or down your back?
Yeah, kind of like that.
Okay.
So it wouldn't loosen up.
Did it ever loosen up? Or you just got used to it?
I don't know.
Okay. All right.
I guess it doesn't necessarily feel loose now, but it doesn't feel like it did after that accident either.
What do you try for the headaches?
I've been on a couple different migraine medicines, but they don't really do anything. Relpax and a couple other ones.
They didn't help at all?
No, they don't.
Okay, and you always have, like right now, do you still have this low grade?
Mm-hmm.
Have you tried? Anything else for the headaches? What about for the neck pain?
No, I mean, I've gone to the I've had a long stint with the chiropractor.
Okay, and does that work for you?
I pay like really big time. When he cracks all my neck, I just start draining all this fluid, and then I'm really sore. My neck is really sore for about 3 days.
Does it help anything?
It feels great when everything cracks into place, but because I'm paying for it for a few days, it's like all my muscles tighten all up around.
I see.
And just like I'm miserable for 3 days, so it's almost worse.
Looks like you've also tried epidurals, steroid injections, physical therapy.
Yeah, so the back doctor with the injections, like he has done some different. So you're talking the neck right now.
Actually, right now, you put down epidural steroids. Where were the injections?
He's done injections in the thoracic, the lower back, and some up on my neck, but nothing like takes or does anything until he went into the epidural space in my thoracic. Then it was like, oh, like I just got this relief for only about 2 days, though, like 2 or 3 days. I don't know why it will only last a couple days.
Right. Have you had that more than once?
Mm-hmm.
And you got relief each time?
Yeah.
But it only lasts for a couple of days.
Yeah. And that to me is not outweighing the risk of going into the epidural space.
Right. Hey, tell me about the physical therapy. What was that done for? Or have you had it more than once?
That's from the accident.
From this latest accident?
Yeah.
Okay.
So I went like twice a week for several months. I was getting some scar tissue right over like right about maybe here ish. But they did at PT they did ultrasound.
Okay.
And that totally broke up the scar tissue thing because that feeling of that knot that would not go away right there and was just like.
And that was on your right side.
Mm-hmm.
Okay. So you got some relief from that, but you still have this feeling that your ribs are
constantly out.
Oh, okay. All right. Are you still doing yoga?
Well, no. Like movement seems to help this situation. This locked up thing. If I'm like I sit all day to work, and if I don't get movement, I'm so much worse off. If I don't.
You put down that sitting in one spot or being in one spot aggravates.
Yeah.
Does it aggravate only the stuff here, or does it aggravate everything?
I don't know that it changes anything with my headache or anything, but it really bugs my thoracic also, and my whole core area. So if I have a couple of days where I haven't been able to take a walk or do a bunch of stretching or get on my old gazelle thingy, then I'm way worse.
All right. The least pain you ever experience is a 4. Average daily is a 6, and up to 9. When it gets up to a 9, what are we talking about? We're talking about your back, neck, your head, your core.
Yeah, I would say my thoracic and my core are the worst. I'm so used to my headache that it's just part of my life. But there's times it's just so locked up and sore and just
thoracic and lower body.
Yeah, and so I'll have to like take an Epsom salt bath to try to unlock.
And does that help?
Yeah, it does.
Okay.
Sometimes that's the only thing that'll.
Okay, and you mentioned a TENS unit here. Where do you apply it?
Pretty nice, wherever it hurt.
And it helps?
Yeah, but only when you're using it. I mean,
all right, well, it just blocks the signal, the pain signal. All right, and this aching, sharp, and something about burning, then it says snake bite feeling.
Yeah, I don't really know how to explain that, but I feel like I've done nerve damage since the withdrawal.
Okay, so that was not present prior to the medication withdrawal.
Right.
Okay, what is it you're feeling?
It's like between the skin and the muscles, but goes as deep as the bone. That there's just like it feels from a snake bite. It's like a sensation of burning, but pain and.
Where is this?
It's everywhere that I have pressure.
Okay, so sitting right now.
Sitting right now, I feel it from here up everywhere that there's. Here, I feel it.
Only the areas that are in contact with something?
Right.
Okay.
And I mean, it'll be up the back of the head. It'll be whatever's touching.
You have that when you're lying down?
Night. Okay. Oh, yeah, totally. I have to move around a lot. I think that bugs me more than anything else I deal with.
And is that, I know it's annoying, is that painful?
No, it's very painful.
And this is only since going through the withdrawal. Mm-hmm. When did you have the injections, the steroid injections? Was that before that?
Yeah, before the withdrawal.
Yeah. All right, so currently you're not on any medicines except, you said you're on one.
Well, I stayed on my seizure medicine during that, but I'm off of that now.
You're off that, so you're not on any.
I'm not on anything.
Not allergic to any medicines that you're aware of. You are married, speech language pathologist. Have you ever been a smoker?
No.
Okay. You never drank alcohol?
Yeah, in the past.
In the past. All right, so when did you stop drinking? Because you said you're not drinking.
Yeah, after like my concussion settled down, then I didn't have a desire to drink anymore.
Looking here, I asked if it affects your ability to fall asleep or stay asleep or the quality of your sleep. You said you can't stay in one position. Major pressure pain. Is that the snake bite stuff we're talking about? Okay. Difficult to lie on your right side because the left pulls too much on the left hip. So if you're laying on your right side, you feel it in the left hip. Where?
Right. So when I'm laying on the side, it's pulling too much on all of this.
All that area?
Pull here. Okay. Yeah. It's really uncomfortable. So I do better sleeping on the more injured side. There's like not any pull against it. Something.
But you still feel that snake bite sensation when you're lying on the side. You said that you did have some other seizures.
Yeah, so I did get a seizure doctor, and they at first thought like generalized epilepsy. So I've had like several during that year, like absent seizures, like standing there doing dishes.
So you've had all kinds of seizures.
Yeah, standing there, and then all of a sudden, like 10 minutes later, don't know why I'm standing there.
All right, so you have lost time.
Mm-hmm.
Okay. Were you on those medicines then, all of those, before the accident?
No.
It was only since the second.
So I was on, all that. Well, I've been on different antidepressants all the way through since.
So you were on
I was on like
antidepressants.
20.
Okay.
Since I've been like 20, so.
What were you taking at the time of the accident?
Everything except for the Adderall.
Okay. So. It says something about body temperature is unstable.
Yeah, so it's never the same. Like I'll be like sweaty but cold.
Okay. Has it always been like that?
Not always.
All right. Here it says headaches. You said always the low grade left frontal. That's every day? Mm-hmm. Okay. Does it stay right there? Or does it ever move anywhere?
Yeah, sometimes, once in a while, I mean, if it's like a bad day, you know, it's all the way across.
Okay. Do you have environmental allergies? No. Okay. But it never goes to the back of the head?
Just if sometimes I do feel it in the back. I mean, I always have pain, like tenderness and stuff. I don't really consider it a headache. It's more like.
Is it mostly on the left there?
Yeah.
Okay. That's actually very interesting. A lot of people with whiplash injuries, they'll have the injury back here, but they'll feel the pain more in front or along the side. So we'll be looking into that. Coughing up phlegm.
Yeah, I'm just always fighting that.
Okay. How long's that been going on?
Maybe like a year.
Do you have any burning in your chest? Or
no.
Is this only when you lie down or at any time of day?
It's all the time. Like, I do have some asthma, but then it feels mostly like a postnasal drip. You know, my doctor said like you definitely have a postnasal drip going on.
Okay.
But I don't really get any relief from just like an allergy pill or anything to not get it.
Do you use an inhaler at all?
Yeah, sometimes.
What is it, like an albuterol inhaler or?
No, it's a steroid inhaler.
Okay. Poor appetite when stressed. In 1 week, you can fluctuate 7 to 10 pounds.
Yeah.
Okay. And it says you think it has something to do with your bones always seem to be shifting. What do you mean by that?
Well, I mean, I just mean like I feel like because my weight fluxes, then don't your bones like move around too? That's my theory.
Just your theory. Okay.
Yeah.
You have been pregnant how many times? Twice. And they were both delivered by C-section. Mm-hmm. Last one, 2010. It says arthritis. What are you referring to as arthritis?
Yeah, just that lower back thing.
Lower back?
And I feel like when the weather changes.
Has that been seen on X-ray or MRIs? Or?
I think it is on the MRI a little bit. And then my shoulders, you know, when the weather changes, I can feel that a lot in this one.
Right around the whole shoulder? Or does it feel deep inside?
Yeah, it feels deep. It feels like it's inside.
You had a kidney infection. How long have you been dealing with the interstitial cystitis?
I was probably diagnosed with that maybe 25 or something.
Okay, it's a long time.
But I've had chronic bladder infections ever basically since I became sexually active at
Okay.
16, and then a few kidney infections too.
Family history, your grandmother did have migraines. Nobody had fibromyalgia or arthritis. And it looks like depression runs pretty heavily in the family. All right. Well, I've got enough information. I'm going to just explain real quickly who I am and what I do, what we're going to do next.